Everybody gets headaches. For most of us, they're only an inconvenience. But for some, the pain is life-altering.
You build up a fear of the headache after a while. You get so worried you're going to wake up with another one the next morning.
Totally incapacitating, ruining my life.
Headaches make me literally feel at times that I want to kill myself.
Headache remains one of the most under-recognized and under-treated disabling disorders of modern mankind.
Headaches are an inescapable fact of life and can be caused by anything from stress to weather to noise.
For decades, doctors have been telling headache sufferers that the pain, it's all in their heads. But this year alone, 45 million Americans will seek treatments for headaches, and millions more will suffer in silence. I'm Kat Carney, and in the next hour, we'll venture beyond the drugstore to find out what causes headaches, and more importantly, what we can do to get rid of them. I know what I'm going to do to get rid of my headache. I'm getting out of here. This place is a madhouse.
We've all gotten one of those headaches, a pounding, throbbing pain that just stops you in your tracks. The most common type is the tension headache, which accounts for 90% of all headaches. We usually associate these headaches with noise, stress, and fatigue. Exactly what the wait staff experiences every day working at this busy restaurant.
There aren't too many noisier places than Durgan Park Restaurant. Do you guys get headaches working here?
Yeah, very
Really?
bad.
How bad?
Bad. Every day, you have a little tension in the back of your head. You have to take aspirins, and the noise is so loud. There's just 18 waitresses at a time. We're all pushing and shoving in the kitchen. We're dropping dishes.
Well, I don't know. I'm looking around, and it just doesn't look that hard to me. I mean, I heard it was stressful, but it just doesn't seem that bad. I think I could do this.
This is what I tell everybody that thinks it's that easy, okay? You can have my apron, and you can take over. Then I can give you 2 of my Tylenols by 6.
Okay.
Okay? Here you go.
All right. I can do this.
Good luck to you.
So many orders, so many dirty dishes, so much noise. It's all stressing me out. The muscles in my head and neck are tightening, and a dull pain is developing on either side of my head. Okay, now I've got a tension-type headache. But what's really going on inside my head? The brain processes all of our sensations, yet ironically, it feels nothing. Instead, the pain we experience during a headache comes from the nerves that surround the brain. When these nerves become irritated, they fire off pain signals. This is a tension-type headache.
Who'd you think it was for? I quit. This job's giving me a headache. So we got a nice day for a bike ride here.
It's beautiful. Beautiful fall weather.
I'm biking with headache expert Dr. Gil Spearings to learn how common headaches are triggered. For me, it's exercise.
Yeah, when you exercise, it's good to keep up your water intake. Otherwise, you do get dehydrated. That makes you feel tired more easily. It makes you feel nauseated, and you also get a headache along with that.
Dehydration may lead to a slight shrinkage of the brain, which can pull on the nerves and cause a headache. To avoid this, make sure you drink plenty of water. There's also a more common exercise headache. When you work out vigorously, you may release a sudden surge of adrenaline. Adrenaline speeds up the heart and increases blood pressure. But this causes blood vessels to dilate and press on the nerves surrounding the brain, triggering a headache. To avoid this common exercise headache, make sure you warm up slowly.
You know, my mother claims that she gets headaches when the weather changes. She claims she can feel it coming on.
A lot of patients, headache patients, are more sensitive to weather change than the weatherman. Because of the people who have sensitive sinuses, when the weather changes, they pick up the change in barometric pressure, and that causes the headache as a result of that.
Oh, well, now, you mentioned sinuses, and I know a lot of times pollen can cause sinus headaches like that.
Oh, absolutely. If you're allergic to ragweed.
Allergens, viruses, and bacteria can also cause the membranes of the sinuses to swell. This swelling can press on nerves, sending a message of pain that translates into headache.
Let's go and have some ice cream and see what that does for headache.
Ice cream.
Thank you.
That's good.
Be careful not to swallow it too quickly.
How come?
You get brain freeze.
Get what?
Brain freeze?
You get an intense pain in the center of your forehead when you swallow the ice cream too quickly. You need to keep it in your mouth a little bit before you swallow it, otherwise it will cool down the back of your throat, and that will give you that particular sensation.
Wow, this has been a great day, Doctor. A walk in the park, bike ride, ice cream, and now wine. This is great.
Let's see how wine affects headache.
You mean like if I get drunk?
No, that would be a hangover headache. That comes the next morning.
When you've had a few too many, life can be miserable. Cotton mouth, nausea, and a pounding headache. Alcohol can block the hormonal mechanism which directs the kidneys to reabsorb water. The result? Your bladder goes into high gear. You get dehydrated, and a throbbing headache along with it. The remedy? Prevention is the simplest answer, but if it's too late for that, drink plenty of fluids. Water, sports drinks, and juices can all take the edge off, but it doesn't take excessive amounts of alcohol to cause headache.
Red wine in particular not only has alcohol in it, but a lot of other chemicals. Chemicals that are a result of fermentation of the skin of the grape.
During the process that turns grapes into wine, biologically active chemicals are formed, such as histamine and tyramine. In some people, these chemicals cause blood vessels to dilate and press on the nerves surrounding the brain. Yet another trigger for headache. Red wine, pollen, dehydration. They're just some of the over 30 triggers known to cause the aggravating pain of headaches.
You build up a fear of the headache after a while. You get so worried you're going to wake up with another one the next morning.
My body is telling me a message when I get a migraine. Basically, stop, slow down, start over. Don't do what I'm doing.
You get very depressed as soon as you feel the head pain coming on, and probably a bit anxious. And then it's often starts in one side and quickly builds, and before you know it, it's covered your entire head. So there's just a throbbing sensation, and you just want to lie down.
They are talking about migraines, a throbbing headache so severe, so painful, that it can knock you off your feet for up to 3 days at a time. Migraine headache afflicts 28 million Americans, or 1 in 4 households. Women suffer 3 times as often as men. Migraines can strike as often as twice a week.
Migraine's like a drum beat in your head. It's like a drum pounding, pounding, pounding.
A migraine is a train. It's just a throbbing, pressure, disabling headache.
It starts with a trigger, bright light, noise, irregular eating or sleeping habits, even foods like chocolate, peanut butter, and meats with sodium nitrates are just a few of the migraine headache triggers. Once triggered, a mysterious malfunction occurs deep inside the brain and causes the normal electrical activity of the brain to go haywire. This electrical disruption causes blood vessels to dilate, irritating a nerve called the trigeminal nerve. In about 20% of migraine sufferers, the irritation of the nerve causes them to experience the aura, a painless visual disturbance manifesting itself in the form of zigzagging lines, shimmering flashing lights, and blind spots.
There's usually like a sunspot, which is the aura, and then it grows, a lot of loss of peripheral vision, goes away. Then there's pain. It's not localized, it goes everywhere.
Back in the brain, nerve fibers around the trigeminal nerve release inflammatory chemicals that cause further blood vessel dilation and nerve irritation. Now the headache is in full swing and the pain kicks in. Many migraine sufferers experience skin hypersensitivities, nausea, and vomiting in addition to the pain. And even ordinary light, sound, and smells can be maddening.
Light's not painful to me, but it drives me crazy when I have a migraine. Too much light. Everything seems too bright.
It does feel like something unreal happens to you sometime during these headaches.
Usually it's just like someone slamming a hammer over my head. It's like just all over pain, it's not in one particular place.
Every sufferer describes migraine a little differently, but the common denominator is always disabling pain. For thousands of years, we have struggled to cure the maddening pain of headache, and even risked death to find relief. More than 7,000 years ago, Stone Age neurosurgeons treated headaches by cutting a hole in the skull in a procedure called trepanation.
It consisted of drilling, using sharp instruments of various kinds, a hole in the skull in one or a number of places, presumably to let out the bad humors or vapors or evil spirits that were causing problems, including headache.
Miraculously, some survived the surgery, though it's likely it didn't improve their headaches. Over time, treatments became less extreme, but not necessarily more effective.
There was a famous physician, Thomas Willis, who prescribed a concoction that was made out of wood lice and millipedes, the juice wrung forth and mixed with distilled water.
Other headache remedies over the centuries included bloodletting, enemas, and ingesting mercury. Considered barbaric today, these extreme treatments are a reminder of how far headache sufferers will go to treat their pain. In 1897, the world changed for headache sufferers. Felix Hoffmann, a chemist at the German drug company Bayer, synthesized sodium salicylate, the first stable and pure form of aspirin.
Aspirin first became available in the late part of the 19th century, and it clearly worked for headache long before we understood why.
For over a century, aspirin has been a wonder drug for headache sufferers. But today, there are a myriad of other drugs to choose from. Americans spend more than $1 billion each year on aspirin and other over-the-counter pain relievers to treat headache. I decided it was time to find out a little more about these pain relievers.
Let me just explain to you some of the differences between some of the medications. On this shelf here, we have a lot of...
There are three major non-prescription pain relievers: aspirin, ibuprofen, and acetaminophen. It is believed that aspirin and ibuprofen work by suppressing prostaglandins, hormone-like substances found throughout the body. In the brain, prostaglandins inflame and sensitize nerve fibers, as well as dilate blood vessels, causing pain.
We also have acetaminophen. This has some pain relief as well.
Acetaminophen works in the central nervous system to reduce pain, but does not affect prostaglandins. So, what should you take for your occasional headache? Well, aspirin is a good place to start, but it can be hard on the stomach, so don't take it if you are prone to ulcers or have a bleeding disorder, because aspirin inhibits blood clotting. Ibuprofen is also effective, but like aspirin, it can also damage the stomach. Then there's acetaminophen. It's not hard on your stomach, but mixed with alcohol, it can be hard on your liver. No matter what drugs you take, follow the instructions carefully and check with your doctor, because many of these pain relievers can have serious, even deadly side effects.
Two, three, four, two.
Barbara Morse knows firsthand the dangers pain relievers pose in the pursuit of headache relief.
I've been getting a migraine or some sort of a headache almost every single day for 3 or 4 weeks. It was a headache I would wake up with. I could always get rid of it, and then I'd wake up with another headache the next morning.
Barbara began taking 4 ibuprofen a day in an attempt to break her headache cycle. After 3 weeks of self-medication, she began to feel the side effects.
I'd had a very busy weekend, been out to dinner a couple of times, been to brunch with friends, and I came home on Sunday afternoon and decided I'd do a little gardening landscaping. And went outside to just put some plants in. Wasn't doing much heavy work, but I needed to turn the soil over. And I had a trowel and I had a shovel, and realized that even just picking up one shovelful of dirt and turning it over to loosen the soil was really difficult for me to do. And then I'd make one hole and go to try and put the plant in it, and just leaning over to pick up the trowel, I almost passed out. I think if I had gone another 24 hours, that I probably would have passed out.
Weak and pale, Barbara immediately went to the emergency department at Emerson Hospital in Concord, Massachusetts. Barbara had blood drawn and underwent an endoscopic exam. Using a long, flexible tube with a tiny camera attached, doctors examined her stomach. The tests uncovered a grave situation. Barbara had lost over half of her blood volume. Barbara underwent a life-saving transfusion of 4 pints of blood. If she had delayed going to the hospital much longer, there is a chance that her overuse of ibuprofen could have killed her. What Barbara didn't know is that aspirin and ibuprofen not only inhibit prostaglandins in the brain, which stops headaches, they also inhibit prostaglandins in the stomach, leaving the stomach lining unprotected. When prostaglandins are suppressed, gastric acids can burn through the stomach lining and expose blood vessels in the stomach wall. Blood then leaks into the stomach and passes through the digestive tract. This is a bleeding gastric ulcer, and a key warning sign is dark, tar-like stool.
But I didn't have any other obvious signs that I wasn't feeling well. And if I was tired or if I was something else, I attributed that simply to the fact that I'd had a headache that morning.
Barbara's is a cautionary tale. Even over-the-counter medications like aspirin and ibuprofen must be used cautiously. Always follow the package instructions and consult your doctor if you are taking them for more than 7 consecutive days.
Even as I look back and I think about that weekend, it's hard for me to believe that I was as sick as I was, and I really didn't realize it, even when they sent me to the emergency room. I think we don't get reminded enough about what the risks are from over-the-counter medications. We figure it's over-the-counter, it must be totally safe.
Author Jane Hosey Bunar has her own classic migraine story. Hers is the unending search for an effective treatment.
The first migraine I got was in graduate school when I was 25. I remember just lying in a shade-drawn room for hours, sometimes wrapping a belt or a scarf around my head because I didn't know any other way to control the pain.
For migraine sufferers, controlling disabling pain is often a struggle unlike any other they've faced. There's no one single drug that works for everyone, and finding the right combination is usually a long-term pursuit.
When I first started to get migraines, they were so bad I hadn't seen a doctor about them. I didn't actually know there were migraines initially, and I would take over-the-counter painkillers to treat them. And eventually, I needed more and more over-the-counter painkillers. So I'd have a whole week where I was taking 20 to 25 pills in a day just to kill the pain.
Using the pain relievers on a daily basis was not only dangerous, it actually perpetuated her headaches. While they alleviated pain for a few hours, when the drugs wore off, she suffered rebound headaches.
A lot of medication overuse is simply driven by desperation. The patients don't know what else to use or what else to do.
Jane then tried several prescription medications like antidepressants, anti-seizure drugs, and heart medications, all of which have been effective in many headache sufferers, but not for Jane.
These are some of the preventive and abortive medications I've tried over the past 8 to 10 years. Sometimes I was taking one at a time, one medication at a time, although this particular one I was taking up to 7 capsules a day. Just recently I was taking 2 medications in tandem and had to add a third when they stopped working. I'm not proud of this. I would rather not be taking medication every day.
In 1993, the first class of drugs specifically designed to stop migraine pain was approved by the FDA. They are known as triptans.
The revolution in migraine really came with the advent of the first triptan drug in 1993 in this country. And all of a sudden we had something that worked specifically on migraine. It didn't just take away the pain like a pain medicine would. It didn't just cover up the pain. It actually stopped a migraine in its tracks.
Scientists believe that triptans activate receptors for serotonin, a neurotransmitter in the brain that plays an active role in the development of headache pain. The triptans reduce inflammation and shrink swollen blood vessels believed to contribute to migraine pain. Today, more than 10 million migraine sufferers, including Jane, use sumatriptan, one of 4 triptan drugs. But Jane is on a new quest. The triptans can help stop a migraine once it starts, but they can't prevent one. Jane is hoping exercise will reduce the frequency of her headaches.
With exercise, I can sometimes control the pain of a daily headache. I don't know if I'll ever get rid of them completely, but I do feel that I have more of the upper hand.
While there remains no magic bullet for migraines, Jane feels that after 15 years of suffering, she has finally gained some control over her headaches.
So Karen, you're an art therapist as well as a migraine sufferer, right? Now,
Karen Cadenhead is an award-winning artist. What makes her art unique is the inspiration for her work. It's migraine pain.
Oh, it's beautiful.
So,
is this yours?
Yeah, this is the picture actually that I entered in an art migraine competition.
No, look, there's a big knot in the middle.
Yeah, that pretty much explains how you feel when you've got a terrible headache.
Severe headache pain is often difficult for non-sufferers to accept, let alone understand. But for Karen, art is the ideal outlet for her to express migraine's quiet ruthlessness.
You feel like you're in this horrible little tunnel, and there's this beautiful world out here. You know, just the toe is touching this great water and bright color, and you can't get out there to experience it.
Does the art kind of take over as you're creating
Well, that's the good part. You know, you wish for an alchemy, that you can take all this suffering and turn out something beautiful, something that can mean something.
Wow, well, you don't just paint and draw, I see you sculpt as well.
That's right. And since you were asking me, out of all of these sculptures, can you find which one I did when I was having a migraine?
Well, that would be easy. That would have to be this one. Right. That would have to be.
And I quit halfway through. I was in a sculpture class and the pain came on and the figure just started going limp and I had no energy to do detail.
Now, does looking at the artwork when you're having a migraine attack, does that help at all?
No, when you have a headache, you just want to be in a dark room and sleep. So, haven't you ever had a headache?
I get headaches on occasion. I don't get migraines though, but I get a lot of stress headaches.
Do you think you'd like to try and express some of those feelings?
I can try that.
Why don't we take this head and show me how you feel when you get a tension headache? And you can add clay to it, you can poke it, you can do anything you want.
I got a better way to show you what my headaches feel like. This. That's what it feels like. Just pounding, pounding, pounding. You know, if it were only this easy to get rid of a headache.
I know, I know.
If you're an adult migraine sufferer, you know how cruel attacks can be. Throbbing pain, nausea, hours or even days of disability. Now imagine having to suffer that kind of agony when you're just a child.
I know migraine's coming on when like I can sometimes hear the pounding or like I just like feel like sharp pains in my head. And regular headaches are just in the front, my migraine's all over.
Leah Hassan started getting headaches in elementary school. Today, at age 13, she gets disabling migraines twice a week.
When she told me about her headache, she said, "Mom, I was walking and this headache just brought me to my knees," which I thought was very rich language for a fourth grader.
I would sit in a corner or something and tell my mom, and she would just give me ibuprofen or Tylenol, but that usually didn't work because it wasn't strong enough.
Leah is among the estimated 5% of children who develop migraines.
The problem of headache in children and teenagers is really underappreciated. I have many young patients who regularly have been missing a lot of school, ending up in the nurse's office, having to skip play dates or soccer games because of severe headache. And over a lifetime, that kind of thing takes a toll. At no other time probably is it more disruptive of somebody's general development and growth than during the very busy teenage and adolescent years.
I always used to go to the nurse, and I knew I'd be missing a lot of work, and by the time that I got back there, I had no clue what was going on because I'd missed so much, and I just got really confused, and it was really hard.
Leah's mother, Marianne, understands her daughter's pain. She also has migraines, and it's likely that Leah inherited her headaches from her mother.
I feel guilty that she has them because of me. I got them from my grandmother. My mother didn't have them.
A child has a 50% chance of developing migraines if one parent suffers, and a 75% chance if both parents suffer.
Did you have any problems from the medication, any side effects?
Today, Leah is getting help. Dr. Elizabeth Loader, director of the headache management program at Spaulding Rehabilitation Hospital in Boston, has enrolled Leah in a clinical drug trial of a triptan medication for children. If the drug works, it could be the first FDA-approved drug specifically for migraines in children. Several months into the study, the drug has made a dramatic difference in Leah's life.
Leah's not the sickly one anymore. It used to be that she would just cry and want to be held.
Leah Hassan is finally free of pain and able to live out some of her childhood dreams.
I don't think Leah could have done cheerleading before her migraines were under control because the practice occurred at the time of day when she would often be crying over a headache.
It has changed my life getting my migraines under control. I am more independent and happier than before because I'm not suffering as much.
Eileen Brogan is willing to do anything to relieve her headache pain. So today, Dr. Zahid Bajwa is going to inject a purified form of a deadly neurotoxin into Eileen's forehead. The neurotoxin is called Botox, a purified form of the Clostridium botulinum bacteria. In nature, this bacteria causes botulism, a disease which can paralyze and kill its victims. But in medicine, it is proven to be a novel drug in preventing headaches.
Initially, when you bring up the idea of trying Botox injections, many patients would say, "Oh no, I'm not going to let you inject a toxin into my body." But then once you explain that it's safe, it has been around for well over a decade, and millions of patients have used it, then patients become more comfortable. No problem, no side effects from the last time we did the injections?
No.
No, everything looks pretty good.
1 year ago, I was probably working half-time because I woke up every morning with a headache, and many days the headache lasted all day.
Eileen has tried almost every type of painkiller, but nothing has worked. Now she turns to the controversial Botox injections. Dr. Bajwa injects a minute amount of Botox into several muscles on Eileen's head. Because of the small dosages, none of the toxins enter the bloodstream, so it remains safely localized in the muscle tissue. Once in the tissue, the Botox temporarily weakens and sometimes paralyzes spasming muscles by blocking the release of acetylcholine, a neurotransmitter in the brain that signals muscles to contract. When the muscles in the head are able to relax, headaches occur less often. But Botox is not a permanent solution. It lasts only up to 6 months, and repeat injections are necessary. The benefits of Botox were discovered by accident. A decade ago, plastic surgeons began injecting the neurotoxin in the forehead to reduce scowl lines, but patients reported that their headaches also vanished. So many doctors quickly adopted Botox as a preventive treatment for headache sufferers. But not all doctors are in agreement.
There are some doctors who strongly believe that this is the best treatment, looking at all of the prophylactic treatments. Then there are others who think it's too expensive, too invasive, and that's what makes it controversial.
At $500 to $600 per treatment for headache, Botox is pricey and generally not reimbursed by insurers. Several recent scientific studies have also failed to show that Botox prevented migraines effectively. Moreover, the FDA has yet to approve Botox as a headache treatment. But for headache sufferers like Eileen Brogan, Botox is a lifesaver.
I'm absolutely thrilled, and it's made a tremendous difference in my work life and in my happiness. I'm not in pain all the time.
It's a pain that is so indescribable, a pain that is so unbearable. And there's just days when I am actually having a severe headache that I just don't want to be here.
It aggravates, enrages, and even leads some to suicide. It is the most painful of all headaches. It is the cluster headache.
Cluster is the most excruciating pain I think I've ever seen, if you can see pain. Patients with cluster will beat their heads on the wall because that makes them not think about how bad their head is hurting.
My cluster headaches make me literally feel at times that I want to kill myself.
Bernadette Ringles is among the over 2 million Americans who suffer from cluster headaches. Unlike migraines, which primarily affect women, cluster headaches affect men 6 times as often.
The feeling that I usually get is pretty much like an ice pick. It's really sticking me in the back of my eye. That's pretty much where my pain starts for my cluster headaches.
The pain typically begins in or around the eye or temple on one side of the head and becomes most intense within 15 minutes. Attacks may last from 30 minutes to 2 hours. Sufferers often get a teary eye or runny nostril on the same side as the headache.
I turn into like one of the meanest people that anyone's seen. It's violent. I slam things, I throw things, and I know that that's not me. I know that's not the person I am. It's only because of all the suffering that's going on in my head.
They're called cluster headaches because they cluster in cycles, usually lasting about 6 weeks. They can occur with uncanny regularity. Bernadette's strike every March.
Why it should happen for 6 weeks and go away, and why, for instance, in Bernadette, it should come every March, that we don't understand.
Yeah, your blood pressure.
After suffering excruciating pain for years, Bernadette visits neurologist Lewis Kaplan at Beth Israel Deaconess Medical Center in Boston. While cluster is the world's most vicious headache, it is also the least understood. But new research suggests that cluster headaches may originate in a part of the brain involved in regulating our body's natural clock, which may explain the headache's regular pattern. Today, there are no specific cluster headache drugs. Patients like Bernadette are limited to using painkillers, anti-seizure medication, and migraine drugs like the triptans. For a quick fix, Bernadette and other cluster sufferers sometimes inhale pure oxygen. This constricts blood vessels, temporarily relieving the pain of the cluster headache.
It does take away the pain for that moment, maybe for about a half an hour, but the pain always comes back.
Springtime is 6 months away, but in the hopes of preventing her next cluster, Dr. Kaplan is already medicating Bernadette with indomethacin, an effective drug for many cluster sufferers. As springtime approaches, Dr. Kaplan will prescribe an additional arsenal of potent drugs for Bernadette that includes several antidepressants and steroid painkillers, all in the hopes of preventing the next cycle. For now, Bernadette must endure the most painful headaches ever imagined in a world that doesn't understand just how bad a headache can really be.
People do not take my cluster headache seriously, and that is one thing that really upsets me, knowing exactly the type of pain that I am suffering from. People look at you when you're saying, oh geez, I'm having a headache, I'm having a really bad one. They look at you like, okay, take a couple of aspirin, it'll go away. But it's not that simple. Suffering from a cluster headache, unless you have actually been through it or know exactly what I'm talking about, you can't say that it's just a headache.
You're late for an important meeting. The clock is ticking, the traffic is building, and so is the tension. It's a diabolical recipe for headache.
Let's say you're driving in traffic. Every time a car passed you or you got irritated by the traffic jam in front of you, your heart rate may change. Your muscles might tense up, but you're not aware of making them tense.
And in the heat of the moment, releasing tension is usually an impossible task. Not anymore. I'm about to experience biofeedback, a scientific relaxation technique that is helping headache sufferers control their body's involuntary responses to stress.
Biofeedback is the use of instrumentation to detect physical reactions or activity that your body is having that are not part of your voluntary control or consciousness. They're automatic.
Biofeedback expert Kim Larson is wiring me up to a computer that will record my pulse rate, body temperature, and forehead muscle tension. All physiological activities that are thought to occur involuntarily. Once I'm wired, Larson will attempt to provoke my stress reaction, but nothing too serious. All she's going to do is ask me a few simple questions. The computer will then process my involuntary stress responses.
Following the relaxation suggestions, a series of questions will appear on the screen.
Which of the following is different? Tree, lamp, cat, feather, lamp.
Without my knowing it, all of the questions are making my heart rate skyrocket.
The yellow line here is your heart rate, your pulse. Can you see how that went up and down and up and down? Okay, so that tells me that for you to settle back into a relaxed state wasn't the easiest thing for you to do.
The next step is to learn how to bring my heart rate down while I'm in the middle of a tense situation. The key is raising the temperature in my hands and feet. Scientists disagree why, but they know that raising body temperature in our extremities is integral in reducing stress. So what biofeedback teaches you is simple, and you can do it at home. Practice visualizing yourself in a warm setting, like at the beach, or next to a fire, or even in a hot tub. Biofeedback scientists say that in time, you can condition your body to regulate its own temperature. All you need are simple thermometers and a quiet space. Once you've mastered body temperature regulation, you can control your stress levels in any situation and become less prone to headaches.
The key to biofeedback isn't to practice what you learn in the session, but to integrate it into your lifestyle outside of your appointment.
Biofeedback is now considered a mainstream therapy. It has been clinically proven in many scientific studies. But what's more important is that headache sufferers now have a way to stop their headaches before they even begin.
Hi, Diane.
Hi.
How are you today?
Crappy. I'm always crappy.
Diane Anderson is at the end of her rope. She has suffered from headaches since she was a child, but a single mysterious headache resistant to virtually every medication has consumed almost every day of her life for the past 7 years.
Have you ever been so down and depressed that you thought about suicide? Yeah, but it wasn't suicide. It was eliminating the pain.
Neurologist Dr. Herbert Markley has worked with Diane for 5 years, attempting to discover the source of her debilitating pain. Finally, after eliminating the more common headaches, Dr. Markley believes that Diane's headache may be the result of a head trauma suffered during a childhood sledding accident.
We call this cervicogenic headache, and what it means is there's damage to one of the nerve roots in the upper neck.
Cervicogenic headache is usually caused by whiplash or other trauma to the head or neck. Doctors can usually make a diagnosis when headaches develop immediately after the trauma. But in Diane's case, her headaches began years after the sledding accident. Dr. Markley's theory is that over time, scar tissue probably developed and is constricting her cervical spine. But he can't be 100% certain because X-rays of an injury like this are inconclusive. There is only one way to positively identify and possibly cure Diane's headaches: surgery. After 7 years of pain and desperate for relief, Diane Anderson chooses to undergo the most invasive of headache remedies.
I hope it works. I hope he can do something because I'm going crazy. I can't take this much more.
The surgery is extreme and still experimental. Neurosurgeon Dr. Joseph Phillips is taking a chance that Diane's condition really is cervicogenic. Dr. Phillips slices into the upper cervical spine, which connects the neck to the head. Very quickly, Diane's problems come to light. As Dr. Phillips exposes the nerve root between the first and second cervical vertebrae, he discovers a knot of ligaments and scar tissue compressing the nerves.
This is really interesting. See, I can see what may be the distal portion of the nerve here, and it's just wiped. It's just absolutely cuffed and surrounded by all this other tissue that's around it.
Dr. Phillips cuts away the ligament and scar tissue surrounding the nerve root. When the nerve root is freed, he injects glycerol into the nerve, killing nerve fibers that send pain signals to the brain. Most doctors say there is little evidence that this kind of surgery provides long-term headache relief. But Dr. Phillips' own study of 40 patients found a 90% success rate.
Doesn't mean that everybody had complete pain relief. In fact, only about a third of them had complete pain relief. But the rest of them who were happy said they had adequate pain relief. That is, the improvement in their headaches was good enough. If we can create a normal anatomy, or if we can restore that anatomy back to normal, perhaps the function that will follow will be normal as well. That is, a pain-free state.
If the operation is successful, Diane will find relief as soon as she is recovered from surgery.
Let me take a look at the incision here. Okay.
1 week after her surgery, Dr. Markley gives Diane her post-operative checkup.
I saw my sister for the first time in 6 months. And we were in a store and we started laughing together over some silly thing. And then she stopped and she looked at me and she said, "You're back." And we started crying. It was... I'm fixed. That's all I wanted. I don't want the pain anymore and I don't want it to come back, and I really think it's gonna stay. Okay. Thank you.
You're welcome.
Everyone has experienced a headache at some point in their life. But rarely is headache a symptom of a serious underlying condition, such as stroke, aneurysm, or brain tumor. However, it pays to know what kind of headaches warrant a trip to the emergency room. A sudden, severe headache that persists or increases for over 24 hours. Headaches with memory loss, confusion, loss of balance, loss of vision, numbness, and loss of strength. Headaches with fever, stiff neck, nausea, or vomiting. Finally, headaches that increase with coughing or straining. Emergency room headaches are rare. The more common headaches like tension, migraine, and cluster affect millions of Americans every day. But often, they suffer in silence and never seek treatment for even the most incapacitating headaches.
Headache, particularly migraine, remains one of the most under-recognized and under-treated disabling disorders of modern mankind or womankind. People should consider seeking treatment for headache if they have headaches that interfere with their ability to function. If they're missing work or they're missing school, even if it's only intermittently, it's important to know that there is treatment out there. And you certainly don't want to wait until it's affecting your life dramatically.
Deciding to seek treatment is the first step in getting help. Finding the right doctor is next.
What we try to tell people is that within 3 months, if they are not getting adequate relief from their headaches, that they should ask for referral to a headache specialist, someone whose practice is primarily devoted to headache management.
Increasingly, alternative doctors are becoming the specialists of choice for many Americans. Each year, we spend more than $14 billion out of pocket on alternative treatments. Treatments like massage therapy, which can prevent and treat headaches by relaxing tissue and musculature, and even help release endorphins, the body's natural painkillers. There is also yoga, one of the most popular stress reduction techniques in America today. Yoga consists of different exercises, stretching activities, and breathing techniques to help the headache sufferer reduce the stress in their lives. Chinese medicine, which includes acupuncture and herbal remedies, has a 5,000-year history.
The Chinese approach looks at the underlying conditions, the root of the condition of why the headaches occur, and it's more a systematic approach of addressing the underlying conditions to clear the imbalances.
In acupuncture, surgical needles are placed in precise areas of the body believed to have too much or too little energy called qi. According to acupuncturists, the needles then move the qi, which restores a healthful balance to the body. In Chinese herbal medicine, combinations of up to a dozen herbs are used to treat the underlying conditions associated with headache. Sinus headaches are treated with Chinese tea, which is believed to act like a decongestant. Licorice supposedly has anti-inflammatory qualities. And peppermint has cooling qualities, which is said to act like an internal cold compress on your forehead. Getting help for your headaches, whether alternative, mainstream, or both, is often a process of trial and error.
You know, since we're not getting rid of headaches anytime soon, finding the right treatment, that's the best place to start. And that means understanding your symptoms and finding a doctor who understands your pain.